Go ahead.
Okay, good morning, everyone. I'll ask that you can all please mute yourselves. We're going to go ahead and start the meeting. So, good morning. I am Clarissa Rodriguez, Chair of the New York State Workers' Compensation Board. Today's meeting is being conducted remotely throughout various locations in New York State, as well as being webcast live for members of the public. Welcome again, and thank you for joining us. Now, board members, please be reminded to state your full name each time you speak, for the record. Now, I have the honor of calling the 1006th meeting of the full board to order. Madam Secretary, will you please call attendance?
Yes, Chair. Vice Chair Foster.
Here.
Board Member Peprocki.
Here.
Board Member Higgins.
Here.
Board Member Lobin.
Here.
Board Member Williams.
Here.
Board Member Hull.
Here.
Board Member Ostley.
Here.
Board Member Crane.
Here.
Board Member Stasko.
Here.
Board Member Taveras.
Here.
Board Member Caginelli.
Here.
Board Member Delon.
Here.
Madam Chair, all members are present.
Thank you, Madam Secretary. Agenda item 1, approval of the December 14th, 2021 meeting minutes. Now, board members, you have all received a copy of the meeting minutes for your review. Are there any questions or need for discussion? Okay, hearing none. Is there a motion to approve the December 14th, 2021 meeting minutes?
Yes, Madam Chair, this is Board Member Linda Hull, and I would like to make a motion to accept the December 14th, 2021 meeting minutes.
Thank you, Board Member Hull. Is there a second?
Yes, Madam Chair, this is Board Member Sam Williams. I second that motion.
Thank you, Board Member Williams. Is there any opposition to the motion? Okay, hearing none. All in favor, please say aye.
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 All opposed? I am also a yes. That motion is passed. Thank you. Agenda item 2, Office of General Counsel's Departmental Report. Now, General Counsel David Wertheim will now present the Statistical and Informational Report for December.
Good morning, Chair, Vice Chair, and board members. Here is a statistical report for December 2021 of the workflow of the 3 adjudicatory divisions of Office of General Counsel. First, in the adjudication division, there were 17,987 hearings held in December, 12,194 cases fully resolved at the hearing, with 412 reserved decisions issued. There were 2,437 waiver agreements finalized, 2,408 of them through the hearing process. In administrative review, 1,151 applications were received, 929 processed, leaving an end-of-month inventory of 3,550. In full board review, 152 applications were received, 125 processed, leaving an end-of-month inventory of 351. That concludes the report. Of course, I would take any questions. Thank you.
Thank you, David. Are there any questions or need for discussion? Okay, seeing and hearing none, may I please have a motion to accept the Statistical and Informational Report of the Office of General Counsel?
Yes, Madam Chair, this is Board Member Linda Hull, and I would like to make a motion to accept the Office of General Counsel's Departmental Report.
Thank you, Board Member Hull. Is there a second?
Yes, Madam Chair, this is Board Member Sam Williams. I second that motion.
Thank you, Board Member Williams. Is there any opposition to the motion? Seeing and hearing none, all in favor, please say aye.
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 All opposed? Hearing none, I'm also a yes, that motion is passed. Thank you, board members. Agenda item 3, license applications. Now Eugene Martin will now present the licensing applications.
Good morning, Chair Rodriguez, Vice Chair Foster, and board members. You have before you the recommendations from the assigned board panels regarding the licensing applications listed in Part 3 of today's agenda. Section 24A, License Hearing Representatives Stuart A. Goldstein, 3-year renewal, and John D. Marks, 3-year renewal. Under Section 53B, Compton Incorporated, Disability PFL only, 3-year renewal. Northeast Association Management Incorporated, 3-year renewal. Under Section 53D, Delta, Omaha National Underwriters LLC, it's an initial application, 1-year term. Ken & Cochran Management Services Incorporated, a 6-month renewal to end on July 31st, 2022. And Johnson & Associates Incorporated, 3-year renewal. I present these recommendations to the board for your consideration.
Thank you. Are there any questions or need for discussion, board members? Okay, hearing none, may I please have a motion to accept the recommendations of the panels as presented in today's agenda, item 3.
Yes, Madam Chair. This is Board Member Linda Hall, and I move to accept the licensing applications as presented by Mr. Martin.
Thank you, Board Member Hull. Is there a second?
Yes, Madam Chair, it's Board Member Sam Williams. I second that motion.
Thank you, Board Member Williams. Is there any opposition to the motion? Hearing none, all in favor, please say aye.
Aye.
Aye. Aye.
Aye.
All opposed? Hearing none, I am also a yes, that motion is passed. Agenda item 4, legal appeals. General Counsel David Wertheim will now present the recommendations concerning decisions by the Appellate Division.
Thank you again, Chair. From the time of the last board meeting till now, there have been 13 decisions by the Appellate Division 3rd Department with respect to workers' compensation claims. These are set forth in item 4 of your agenda, 4A through 4M inclusive. Of these decisions, 10 were affirmances, 3 were reversals. It is the recommendation of Office of General Counsel that the full board adopt all of the decisions of the court as the decisions of the board. Thank you.
Thank you, David. Now, may I have a motion to accept the recommendations of the Office of General Counsel?
Yes, Madam Chair. This is Board Member Linda Hall, and I would like to make a motion to accept the recommendations by General Counsel regarding the legal appeal.
Thank you, Board Member Hull. Is there a second?
Yes, Madam Chair, this is Board Member Sam Williams. I second that motion.
Thank you, Board Member Williams. Is there any opposition to the motion? Okay, hearing none. Board members, all in favor, please say aye.
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 All opposed? Okay, I am also a yes, that motion is passed. Thank you. Agenda item 5, mandatory full board review. We start with case 5A, Creative Installations, Inc. Case number G2900324. Is there a motion with respect to 5A on the agenda?
Yes, Madam Chair, this is Board Member Pamela Caginelli, and I move that neither the majority nor the dissenting be adopted.
Okay, thank you, Board Member Caginelli. Is there a second to the motion?
Yes, Madam Chair, this is Board Member Mark Higgins, and I second the motion.
Thank you, Board Member Higgins. Are there any recusals? Okay. Hearing none, is there any opposition to the motion? Hearing none, all in favor, please say aye.
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 All opposed? Again, hearing none, I am also a yes, that motion is passed. Thank you. 5B, Manhattan and Bronx Surface Transit Operating Authority. Case number G284 5448. Is there a motion with respect to 5B on the agenda?
Yes, Madam Chair, this is Board Member Sam Williams. I would move that the majority opinion be adopted as the opinion of the full board.
Thank you, Board Member Williams. Is there a second?
Yes, Madam Chair, this is Board Member Mark Higgins, and I second the motion.
Thank you, Board Member Higgins. Are there any recusals from this matter? Hearing none, is there any opposition to the motion? Okay, hearing none, all in favor, please say aye.
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 All opposed? Okay, hearing none, I am also a yes. That motion too is passed. 5C, Regional Transit Service, Inc. Case number G2349243. Now, is there a motion with respect to 5C on the agenda?
Yes, Madam Chair, this is Board Member Stephen Crane, and I move that the majority opinion be adopted as the opinion of the full board.
Thank you, Board Member Crane. Now, is there a second?
Yes, Madam Chair, this is Board Member Mark Higgins, and I second the motion.
Thank you, Board Member Higgins. Is there any opposition to the motion?
Yes, Madam Chair, this is Board Member Pamela Caginelli, and there is opposition to the motion.
Thank you, Board Member Caginelli. In light of the opposition, I now call upon the Secretary for a roll call vote.
Board Member Osili.
No.
Board Member Caginelli.
No.
Board Member Crane.
Yes.
Board Member DeLon.
Yes.
Board Member Higgins.
Yes.
Board Member Hall.
Yes.
Board Member Logan. I'm sorry, we have lost Mr. Loban temporarily. I'll come back to him. Board Member Peprocki.
Yes.
Board Member Stasko.
Yes.
Board Member Taveras.
Yes.
Board Member Williams.
Yes.
Vice Chair Foster.
Yes.
Chair.
Yes.
I've received communication from Board Member Loban. He is listening. Apparently he can hear us, we just can't hear him.
Okay.
And take his vote.
Can we have his vote?
Yes, you could take his vote.
Okay, stand by. Board Member Loban is a yes.
Okay, thank you, Madam
That
Secretary.
motion is passed. Excuse me. 11-2.
Thank you, Madam Secretary. Agenda item 6, discretionary full board review. I turn this portion of the agenda over to Vice Chair Frida Foster.
Thank you, Madam Chair. For the cases listed in item 6 on your agenda, it's been recommended that full board review be granted. Those cases are 6A, Town Village of Harrison, 6B, New York Black Car Operators, 6C, New York City Transit Authority, and 6D, Department of Corrections. I move to refer the cases back to the respective panels for further consideration.
Thank you, Vice Chair Foster. Now, is there a second?
Yes, Madam Chair, this is Board Member Sam Williams. I second that motion.
Thank you, Board Member Williams. Are there any recusals? Is there any opposition to the motion? Hearing none, all in favor, please say aye.
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 Okay, thank you. All opposed? I am also a yes, that motion is passed. Thank you, board members. Agenda item 7, is there any other business to discuss this morning? Hearing none, then we'll move on to our main event, our guest speaker. I'd now like to introduce our next presenter, someone who joined the board just a couple of months after the start of this historic pandemic that we're still living with. The board's medical director, Dr. James Tachi. Now, before joining the board, Dr. Tachi was an attending physician in the Division of Occupational and Environmental Medicine at Strong Memorial Hospital and held several positions at the University of Rochester Medical Center, including serving as associate professor, as well as program director of the Department of Public Health Services, General Preventive Medicine and Public Health Residency Program, and as a medical director of their Travel Medicine Passport Health of Upstate New York. He has also overseen medical services and worked to ensure the safety of employees at major corporations, including Xerox and the Delphi Corporation. Now, shortly before starting with the board in 2020, Dr. Tachi said he was eager to hit the ground running, and boy, did he. Since he arrived, the board has adopted more than a dozen new or updated New York medical treatment guidelines, overseen changes related to the expanded provider law, and created guidance for stakeholders transitioning to the CMS 1500 form. Now, let me just say how fortunate the board is and how pleased I am today to introduce someone who's such an important part of our mission of helping fellow New Yorkers, Dr. James Tachi, who is going to provide updates on the board's medical director's office. Welcome, Dr. Tachi.
Thank you, Madam Chair. Thank you, Madam Vice Chair and board members. It's a pleasure to see you all this morning. I'm going to share my screen. And for some reason, I'm not, there we go. Kim, for some reason, it's not allowing me to share.
I may have to go all to you. Hold on here. I'm sorry, Chair, you have the ball. Can you move it? You should be all set now, Dr. Tachi.
Okay, so I'm sharing my screen. And if you all could let me know if you're seeing my slides, that would be great.
They're there. Yep, we see them.
Yes, we see your slides.
Very good. Thank you again for asking me to join you all this morning. I'm just going to give hopefully a brief update on the medical director's office and what Chair Rodriguez mentioned was a very busy 2021. As Clarissa mentioned, I am based in Rochester, in the Rochester District Office. I do come to Albany on occasion. So while I know some of you, there are several that I have not yet met in person because of the COVID-related restrictions. So I'm looking forward to all of us coming out of the COVID-related hibernation at some point when I get to meet everyone in person. People probably know this, but just as a general overview of the medical director's office and our organizational responsibilities, we are in charge of the medical treatment guidelines, or MTGs. We have a provider compliance unit that authorizes new providers and then oversees complaints and issues and questions, et cetera, related to our authorized providers. That includes both treating providers and IME providers. We have a medical fee schedule and fee schedule arbitration unit. We have a drug formulary unit. We have a new DME fee schedule unit, which will become effective with OBLR implementation. And we collaborate on a regular basis with several organizations within the Workers' Comp Board, where we don't necessarily own the specific project, but we share our subject matter medical expertise on issues that are important across the board functioning. So 2021, as Chair Rodriguez mentioned, was a busy year with respect to medical treatment guidelines. Prior to, in 2020 and 2021 sort of melded into each other a bit, but previously we had 5 medical treatment guidelines: neck, mid, low back, shoulder, knee, and non-acute pain. All of those were updated in 2021. We also developed 5 new medical treatment guidelines for depression, PTSD, CRPS, or complex regional pain syndrome, traumatic brain injury, and work-related eye disorders. Also in 2021, we had several what are new medical treatment guidelines that were sort of waiting in the queue. They had been developed really over the 2020 period, 2019-2020 period: ankle, foot, hip and groin, hand, wrist, and forearm, interstitial lung disease, and asthma. And all of those were brought forward as well. Along with our 16 now medical treatment guidelines, we've developed 16 online training courses. We have over 600 providers per month taking over 3,000 courses per month. They all provide CME, continuing medical education credits for those providers who need such credit. And they're also open to anyone else who wants to familiarize themselves with the clinical component of the medical treatment guide. In addition to that, on a monthly basis, we issue about 500 notices of resolutions for questions related to prior authorization requests, et cetera, related to the medical treatment guidelines. And we field about 350 or 400 telephone calls per month with questions on the guidelines. With respect to provider compliance, I think it's worth taking a small step backwards, not only in 2021, but to January of 2020, when the expanded provider law went into effect. Since that time, almost 14,000 healthcare provider applications have been processed for board authorization with respect to the expanded provider law. Presently, we process approximately 350 or so applications per month, roughly 3/4 of which, about 275, are the new provider types listed in the expanded provider law. Applications are held to a very high standard, and some are actually denied each month, depending on whether or not the applicant makes the criteria. We field roughly 250 or so emails and letters per week related to provider compliance, and we have to address approximately 100 or so or more complaints each year related to various types of provider issues. With respect to fee schedule, formulary, and fee arbitrations, as folks know, we have done some modifications to the fee schedule. We have a newly developed DME fee schedule, durable medical equipment, which will again go into effect with onboard limited release. That will be much easier for DME suppliers, providers, payers, et cetera, in terms of knowing what the fee schedule is for various items of durable medical equipment, and simply providing the equipment and getting reimbursed, as opposed to the very labor-intense and burdensome prior process of affixing invoices and whatnot. We have updated the drug formulary, and with respect to arbitration, we have about 500 or so requests processed weekly. And I would say that the arbitration wait times between the arrival of the request for arbitration and the final resolution have been decreased to the lowest in years. I think perhaps even the lowest ever, but the wait times have been significantly decreased, which is gratifying for all parties involved. And then lastly, with respect to, again, a lot of initiatives we don't and could not do on our own, but we lend subject matter expertise to, again, multi-organizational efforts across the board. Example of these include the electronic C4.3 form, which will not only make submission of the C4.3 forms much easier, but also much uniform and consistent with respect to the information that we gather and gathering it in a timely manner. As folks know, Onboard Limited release is set to go live soon, and it will be a phased go live. Phase 1 will be medications, refills, and renewals, as well as HP1 submissions. Phase 2 will be durable medical equipment, including the DME fee schedule. And phase 3 will be MG1s, MG2s, C4 auths, as well as special services requests for the delineated special services requiring prior authorizations. Another very large project which we've contributed to is the CMS 1500 project. That is slated to go live. It's already in the process. It's in phase 2 right now. It will hit phase 3, which is mandatory compliance July 1st of this year. And I think the CMS 1500 project promises to make workers' comp billing easier, once again, for all parties involved, for providers, for payers, et cetera, and everything that we can do to make the system that much more frictionless for the participants, the better. We have permanent telehealth regulations in the works. And, I think that the COVID-19 pandemic taught not just the Workers' Comp Board, but all of medicine how to do telehealth better and what the advantages were and what the pitfalls to watch out for. Having learned from that, we are in the process of implementing permanent telehealth regulations. And then finally, with respect to the medical fee schedule, we will be updating the medical fee schedule again. And our goal there is to just make the process itself as easy, fair, straightforward, and streamlined for all of the participants, for the providers, for payers, et cetera. So the fee schedule has been updated, and we will be looking to do it again in 2022. So that is our whirlwind overview of 2021 and a brief look forward into 2022. Thank you, everybody, for allowing me to join you this morning. And if there's ever any topics from a medical director's office standpoint that you'd like to hear more about, I'm happy to join you.
Thank you very much, Dr. Tachi, for that overview. Now you can go ahead and stop sharing your screen, and I will ask the board members if I may please have a motion to adjourn today's meeting.
Yes, Madam Chair, this is Board Member Linda Hull, and I move to adjourn our meeting.
Thank you, Board Member Hull. Is there a second?
Yes, Madam Chair, this is Board Member Sam Williams. I second that motion.
Thank you, Board Member Williams. Is there any opposition to the motion? Okay, seeing and hearing no opposition, all in favor, please say aye.
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 All opposed? I am also a yes. That motion is passed. Meeting adjourned. Have a good afternoon, everyone.
Same to you.